Fine.
We got done. We got till 6:30.
Okay.
That's 22.
Okay. How would you feel if you knew one day that you would have no memory of your life? This happens to people with Alzheimer's disease. People affected with this disease lose both their long and short-term memory. I cannot imagine not being able to remember anything in my life, and the disease may get to the point of not recognizing family or friends. Alzheimer's is a disease of the brain that causes problems with memory, thinking, and behavior. The connections between brain cells and brain cells themselves degenerate and die, causing a steady decline in memory and mental function. Alzheimer's gets worse over time. Although symptoms can vary widely, the first problem many people notice is forgetfulness. The disease may cause a person to become confused, lost in familiar places, misplace things, or have trouble with language. Some symptoms you may notice with a person who has Alzheimer's is the memory loss. They may repeat statements and questions numerous times without realizing it. A person may also forget conversations or events and eventually forget names of loved ones. They may lose their knowledge on what day it is or even the year. Those with the disease may have a hard time thinking of words they want to say, and over time their writing and reading skills also decrease. Eventually, those with advanced Alzheimer's will forget simple tasks such as dressing, bathing, and how to eat. With the brain changing, this may also affect the way a person feels. They may experience depression, mood swings, changes in sleeping habits, wandering, and distrust in others. According to Mayo Clinic staff, scientists believe results from a combination of genetic, lifestyle, and environmental factors take effect on the brain. You are not able to predict if a person will have Alzheimer's based on genes. The causes have remained unknown. However, the causes on the brain are very clear. With brain cells dying, the brain shrinks, so when doctors examine the brain, they notice distinct abnormalities on the brain. The first type noticed is called plaques, that are proteins called beta amyloids that destroy the brain in many ways. Another tissue in the brain found is called tangles, in which brain cells rely on transporting nutrients throughout the brain. A protein called tau is a part of the tangles because the protein will twist into abnormal tangles inside the brain. Risk factors to consider is the increasing of age. A person may get the disease as early as the age of 65 and will usually have it by the age of 85 if they are going to have the disease. However, people have been known to develop symptoms when they are in their 40s and 50s, but may not have as many damaged cells. According to National Institute of Health, women are more likely to develop the disease than men, mainly because women generally live longer than men. Yet this is still unclear. Scientists have put hormones and menopause into consideration that prepare the body to change. People also with severe head trauma are at greater risk of the development. Some evidence suggests that the same factors that put you at risk of heart disease may also increase the chance that you'll develop Alzheimer's. Examples include lack of exercise, smoking, high blood pressure, high blood cholesterol, poorly controlled diabetes, a diet lacking in fruits and vegetables, and a lack of social engagement. According to AlzheimersAssociation.org, there are 7 stages of Alzheimer's. Stage 1, no impairment, meaning the person may not notice any memory loss. Stage 2, very mild cognitive decline in which the person may feel memory lapse and forgetting of familiar words. Stage 3, mild cognitive decline, and some of the diagnosis of the disease may be done early, and friends and family will start to detect something is not right with the person. Stage 4, mild or early stage. A person may have complications in completing tasks and forgetting recent events. Stage 5, moderate or mid-stage, in which they need help with day-to-day activities and are unable to recite their own address or phone number and become confused on where they are in the day. Stage 6, Moderately severe or mid-stage. They are able to distinguish familiar faces but may forget the names of their spouse or caregiver. Needing help dressing and toileting, in which most have uncontrollable bladder and bowel at this stage. They wander and become lost. Stage 7. Severe or late stage. They need help with daily cares and also lose the ability to smile and need support in sitting up and holding their head up. Reflexes become abnormal, muscles grow rigid, and swallowing becomes impaired. There is not a specific test that confirms the disease, but doctors will perform a physical and neurological exam. This will check reflexes, muscle tone, strength, sense of sight and hearing, coordination and balance. There are 2 cognitive drugs that help treat cognitive symptoms but will not get rid of the disease. In conclusion, Alzheimer's disease is an uncontrollable disease that affects many people. Seeing others have this disease is very sad, especially when they do not know themselves or family members. Diagnosing a person with the disease is easily done after a few tests. I included steps to take in life that may help control or prevent this disease. Even though a person with the disease is not in pain every day like a person with cancer is, the family instead is in pain from their loved one not having any memory.